Okay, we'll, we'll come back to her. I just want to make sure your mic works though. Okay, well, aside from those of you work group members, we also have staff from the revisor's office, revisor of statutes. We also have some other KHI staff on, and we also have some staff from KLRD. And I see a few others that have joined. And so, Connie, do you want to introduce yourself really quick, just name and title?
Connie Freeze, Blue Cross Blue Shield of Kansas City, Vice President, Government Relations.
Thank you. Jason?
Good morning. Jason Grunstrom, Executive Director of the University of Kansas Health System of Continuum of Care.
Thank you. Shauna?
Good morning, Dr. Shauna Wright, KU's the Associate Director of KU Center for Telemedicine and Telehealth.
And then Senator McGinn, I'm going to try one more time. All right. Well, I'm going to move forward. And so the purpose for today's meeting is to ratify the report from this working group to the special committee. So the draft report was sent to you on Friday for review. And beyond that, we'll pause on kind of each of the recommendations that your working group has worked on through the course of this session and to ensure that we're not missing any final edits. So really, we're going to talk about any technical edits. And then if you do have a substantial edit, we'll talk about it then. Our goal with this review is to ensure that each of the recommendations are presented for this special committee in a way that's clear and correct. Okay, we want to make sure they're clear and correct. And hopefully we won't need the whole time, but we'll see what happens. Before I move on, is there anyone that joined that hasn't announced themselves? All right. The second objective of this meeting is also going to be to make sure that we're prepared for the special committee presentation. And so I will be asking for volunteers. And so get ready for that as well. So I'm going to stop sharing this and I'm going to share my next item, which is bringing up the report. So if you are following along on your own computer and not with my computer, then I will make sure and cue page numbers so you know where to go. Some people like hard copies as well. So before I jump into this, any questions? All right, I'm not seeing any, and I'm going to grab my chat box again just in case. All right, so firstly, in the acknowledgements, we do acknowledge some of the special supplemental experts that we had all along, and so those names are in there. And then after the table of contents, we come to kind of the background and introduction. Were there any comments or questions for clarification with the background and introduction? All right, then moving on. We talk about navigating the report, your definitions for immediate action and strategic importance, and then going through the work group process. So I'm on page 7 now. So this work group was assigned to a new topic, and the new topic was related to payment parity, including both for behavioral health services delivered via telehealth and for medical services as well. And so this is a topic that will be discussed by your co-chairs, and I will ask for volunteers later if anyone else wants to present that to the special committee as well. Any edits or changes there? All right. Next is the work group process. So your group met, including this meeting, 5 times, and it gives you kind of a brief overview of your journey. So we reviewed and revised the vision and previous recommendations from 2020. During that second meeting, staff from the revisor's office provided an overview of the Kansas Telemedicine Act, and also there were revisions made to the 2020 recommendations, and then there was some starting discussion on the new topic. November 15th, presentations and discussion were provided on the new topic, and there was also some data on utilization rates that were reviewed. And then on your fourth meeting on December 2nd, you also took a look at some claims data that day, and you finalized recommendation language and also those characterization matrices, so the rubric. And then we're meeting today to finalize the plan. And so any edits or revisions to that? All right. Now that we're done with all the administrative parts of things, okay. Anyone, we're going to go through and look at the data profile really quick. I apologize. All right, so the data profile.
Hina, this is Sean Wright with the Center for Telemedicine.
Sure.
Can you, for those of us that are going along with our printed copies, can you update us on what page you're on?
Sure, I am going down to page 13 for the data profile. Let me know if that doesn't match you. All right, and so for those of you that had a chance to review the 2020 report and be a part of that presentation, the data profile is kind of your systemic view, high level 10,000 foot view of the behavioral health system for Kansas. And the table below just has select parameters where data was available for 2021. Especially with the pandemic and a few other reasons, other data were not available. So only 2021 data that was available has been published for this year. And so this will be discussed during the special committee meeting as well. Any questions on that? All right, so now for those of you that get dizzy, close your eyes because I'm about to jump to page 35, okay? Oh, I actually made it. All right, so now we are on page 35. This is the vision statement that was both revised and agreed upon at your last meeting. Just one last chance to provide any technical edits if you see any. Otherwise, is everyone in agreement with the language you see for the vision? Just head nod, thumbs up, any of that. We'll look for visual cues. Yes.
This is Sandra with United.
Yeah.
And it's my understanding that the changes we're making in this report will be reflected as new changes in the report for, I'm not saying this right. Will there be a way to differentiate what we're adding to the report from last year?
So do you see how it shows red line, underlined text here? That's how it will be presented to the committee.
Okay, thank you.
Yep, that's a great question. Thank you, Sandra, for clarifying that. Any other questions?
I had a question. This is Jason from the University of
Yeah.
Health System. I think at the conclusion, we're recommending the telemedicine committee. And Representative Landwehr, you probably can answer this best, or whomever. It's a recommendation, but does this go anywhere if the recommendation is thought of as a nice thing, but actually don't move or act on creating the committee? What, or are we kind of saying we want a committee and we know one is going to happen? I don't quite understand the recommendation, and then with the important work that we're doing, if the recommendation is not accepted, does that make sense? Is that what we're asking, for them to accept the recommendation? And if it doesn't get accepted, what happens with this body of work?
Okay, because I don't believe you were with us last year, is that correct?
I wasn't with you last year, that's correct.
All right. Okay, so Representative Landwehr here. The way this process will work is once this report is prepared, then it will come before the full committee, and you're all welcome to participate on that. We had to cancel the meeting for this Friday. We will have the meeting on the 15th and possibly the 16th, which was already scheduled date. So it's not like those are new dates on your calendar. Then the legislators on the committee, we make the final decision, but we can also have roundtable discussion like we're doing here with any of the working group members that want to be available that day to help us work through this process. And it allows us then to finalize this document to be submitted as a report to the legislature. Then it is up to whatever committee needs to maybe look at some of these recommendations. And I can guarantee you that the Health and Human Service Committee looks at all of these recommendations. And then we try to figure out which ones that we can advance, which ones we can get into bill form, what's the best path for those to take. So that's the process. Did I answer your question?
You did. I was nervous a little bit around the work that we're doing right now is so important. I couldn't really understand the distinguishing between our recommendation and the body of work we've done, separating that from this other recommendation of the telemedicine committee, and if they were mutually exclusive, I would say, from the work that we're doing right now. So I just didn't want to lose this body of work in terms of creating a new committee to essentially start over again. That was just my concern.
No, and that's actually, Jason, that's one of our goals with the way that we have structured this committee, is for us not to lose that continuity and to lose that flow, so that nothing gets dropped. That's why it's very important for the checklist that we have on the back side of this report to show us what we have completed and we haven't. So anyone will have access from a public perspective once we release this report to look at it and say, well, gee, why didn't they do this one? Why isn't this one checked off? Why isn't, so that's where, and to the unpleasantness of one of my legislative research staffers, I call it a living document because I want it to stay alive. I want that checklist to be maintained out there for us for people like you and anyone else that's involved, that we continue moving forward to improve this process.
Thank you.
Carrie, do you have your hand raised?
I do. This is Carrie Breffett from KHI, and Madam Chair, you can correct me. I think you referenced this, but wanted to clarify for Jason and others that maybe weren't part of it last year. The report doesn't just go in a written form and like get in an email and get sent to committees. It's actually presented to the committees as well, the health committees. So folks who are on the working groups often participate in presenting the recommendations. So there's also the opportunity with the legislative committees, the sort of regular session, the standing committees as well, to be able to present the recommendations of the working group. So there's a lot of really good effort by the folks that were on the working group and the special committee members who are also on these standing committees to make sure that the full context of the discussion is presented.
And Jason, Representative Landwehr here, I might add, I'm sorry, Heen, I talked over.
Go ahead.
Is that at any time, you're more than welcome to stay involved with this process and stay in contact with any of us, because the healthcare field is not my field in my private life, but it has become my passion in my political life. And I rely on the experts. And that's why this committee is structured the way it is, because I have those of you that are out there actually doing this work, helping to guide the legislature rather than us just coming with anecdotal Band-Aids. We're trying to actually improve the system. And we were actually able to do that last year through this process. Is we changed the way mental health services are handled in Kansas for the first time in 30 years.
Yeah, that was phenomenal work. I appreciate that. And thank you for your explanation. It just, on Friday, I was having a lot of technical difficulties. And when this committee was recommended, there's just a little voice in the back of my mind that felt like we were putting down all the work that we've done up till now to create this new committee, just do it all over again. And so that was just my question. So thank you.
Questions are always good. You can ask anybody on here that's worked with me. I am Miss Questions, and that's how I learned.
Thank you.
Thank you, Jason. That was a good point of clarification. Hina Shah, KHI. And the only last comment I'll make is to read this report as a wraparound to your 2020 report. As Representative Landwehr said, this is a living document. And so you have your 2020 report. And as Sandra helped clarify, that red text and underline really shows where there's updates or revisions to a recommendation. And then I'll show you how the revision shows on your 2020 recommendations. But this is your new recommendation. And so it's on the telemedicine committee and having to establish that. And the rationale behind it was really wanting continued need for education and discussion around this. So as we go forward, are there any edits, technical edits or substantial edits that you would like to make to the recommendation? Or is it written as agreed upon?
Could you scroll down a little bit further?
Sure.
And make sure that, because we gave a recommendation on the, and it's not in here. Okay.
What would you like to add?
So actually, so we had providers, consumers. Okay. I missed it. It is in there.
Okay,
Thank you.
terrific. Any other edits? Technical or otherwise? Give me a good head nod, thumbs up, a shake if you're in agreement with this recommendation. I like it. All right, then we're going to move on to the revisions to the 2020 recommendations. Okay, and so here, those of you that are looking at the screen, you'll see in red ink and underlined. I will add the underline here. I'll make sure. Where there have been any revisions to the recommendation, again, this was the language that was agreed upon at your December 2nd meeting. However, since reviewing the report, if you have any other technical edits, please let me know. So now's the time. The other thing to note is we wrote the rationale for revision this time. So if you want to look at the initial intent for this recommendation, you will have to refer the 2020 report for that rationale. So that was one change I wanted to bring up.
Tina, Representative Landwehr here. Do we have a definition of quality assurance standards?
We do not. Is that something you would want to add, or something that you would want to say that maybe in the future the committee really needs to think about some of these definitions?
I think we need to, and I'm not quite sure what that wording should be, is so that people understand, because when you first read that, now, we're all reading it into detail. But if someone's glancing at that, they may think that there are quality assurance standards out there. So how do we clarify, really say this has to be developed? And then how do we come up to develop that? Is that what we're going to ask for the LCC committee to do?
So at this point, you have various action leads and collaborators helping with this. And so it's a lot of entities that will need to come together. If this is something you would want to make as part of the new telemedicine committee's charge, we could add a note that says refer to recommendation 10.6 to help develop these standards. Is that something this work group would like to put forward?
So
I
it's
think,
Go ahead.
I think that makes sense. From my perspective, and we'll hear from everyone else, I think that makes sense so that we make sure it gets defined into an action section of everything we're doing and doesn't get overlooked.
And this is
So that's a
Sean.
recommendation. So would that be something under the first bullet point up above where it says established consistent guidelines? Would we say guidelines and standards? See that first bullet point where we're establishing that? I mean, would that be where we create the recommendation to Representative Landwehr's? Because I'm not looking at 10.6 right now because this is 10.1, isn't it?
Yes, so 10.6 is your new recommendation, just so you know, the telemedicine committee.
Okay.
I think it has to be tied back, Representative Landwehr here, tied back to 10.6 so it doesn't get overlooked.
Okay.
And
This
then,
is Shauna Wright with the Center for Telemedicine. I think there are two different issues. I think that first bullet point talks about guidelines for actual telehealth delivery, right? But what I heard, I think, and please correct me if I'm wrong, Representative Landwehr, is that we really want to identify the elements of how we measure quality assurance, right? So we need to look at that in the domain of healthcare as well as the domain of telehealth, and have the committee really identify, as we measure quality assurance, what are those elements that must be there? Is that what we were looking at to add, Representative Landwehr, was what elements define or are captured by quality assurance?
I think that you're right on that, Shauna, because we all have to remember is that we're a little bit out of the scope of this committee, but it got tied back into it because telehealth defines mental health as well as physical health. So when we look at telehealth, we can't separate those two issues.
Right.
And I think that we have to remember that as we move forward. So yeah.
Hina, it's Eileen from the revisor's office.
Yes.
Under 10.1, when you added provides services can you go back to that?
I am. Yep. Give me 1 second. I think I might be sharing the wrong document, I was just told. So I apologize. Give me 1 second.
No, Hina does not make mistakes. We know that. Someone
Give
played
me
with
a-
your computer.
It was me. I'll
Lost
fess
in,
up.
yeah.
The good thing is she's going to share a slightly different version, but it doesn't change any of the language that you've looked at so far. It's just to make sure any edits we make that you all make are going to be in the form we're using. So
Well, this is not a small document to work with.
yeah.
All
What
right.
happened to our
Eileen-
16-page report, huh?
Yeah,
I
know. Eileen, you were actually breaking up a little bit there, hun.
Oh, well, I will try to speak louder.
No, it's not volume. It's you're coming in, breaking in and out. But I'm not sure why.
I don't know. I'm sitting in my office in the State House, so.
There's your problem.
Uh-oh. All right, we are back in action. It looks the same, but I'm just making sure I put it in the right version. So we are
Okay.
Go ahead, Eileen.
So in the third bullet point where it says allowing services to be provided flexibly, and then we added as stated under the Kansas Telemedicine Act.
Mm-hmm.
The Kansas Telemedicine Act doesn't state that.
Right. The conversation that came up around this was to really make sure that phone was allowed.
Right.
And so with broadband, and so I will defer to other work group members to talk about this. And if there needs to be clarity in language, Eileen, do you have a suggestion for the work group?
I would say allow services to be provided flexibly utilizing the Kansas Telemedicine Act, because you can't say stated using the language that you put there because it's not stated.
Is everyone okay with that? I'm seeing head nods, thumbs up. Great.
Hi, this is Sunny Mickle from Blue Cross and Blue Shield of Kansas. Thank you for making that clarification, Eileen. When this issue came up at the last working group meeting, the discussion was about not wanting to have it appear that we were using technology that was not HIPAA compliant, and wanting to make sure that we were compliant in following the guidelines within the Kansas Telemedicine Act. But I do understand what you're stating here, so thank you for that.
All right, and going back to bullet point 1 with establishing the consistent guidelines in developing the quality assurance standards, would the work group like kind of an overall recommendation to task this work to the new committee, or do you want me to state that explicitly in the recommendation language above? Basically to task the newly developed telemedicine committee to develop quality assurance standards. How would the work group like to handle that?
It's the standard with United, and I think with telehealth still developing, and we still have a lot of unknowns around how telehealth is going to fully mature.
Mm-hmm.
We might want to toss it. That would be my vote. I think there's still so many things we just don't know yet.
Okay. Is everyone in agreement to link this then back to that telemedicine committee? Okay. All right. Any other technical edits or substantial ones? All right, 10.1, give me a thumbs up, head nod, something if you're good with it. Yay, I like the smiles too. All right, on to 10.2. Again, in red, we've noted the revision to the language, so it allowed for a little more clarity. Any further revisions to this? And then I'm going to scroll up just a little bit so you see everything.
Run, Hina, there's no objections.
I know. Is everyone good? Thumbs up, head nod, smiles. All right. 10.3. So this one was technically checked off in the checklist. And so the revision that was made to this recommendation was to continue the coverage for the telehealth crisis services, but then adding on to really engage professional associations to adopt appropriate education. And so any changes, technical or substantive, to this recommendation?
I had a question. This is Jason from the University of Kansas Health System. When we say engage for adopt appropriate education for providers, were we going to actually create a committee that would then list appropriate education for providers?
So the task lead for this one is KDHE, and there are several collaborators on here.
Okay.
So so it would be up to the agency to reach out and really push through and implement the actions for this recommendation.
Okay. Thank you.
Representative Landwehr here. Jason, one of the reasons for that is the legislature can only take on so much with the time limit that we have. So we do have to rely on our agencies as well.
Yeah, this one was just confusing to me because it seemed like it tied two different thoughts together as one. One was just continue the coverage, and another one was also now establish a education kind of program for these professional associations. And so I was trying to understand how we connect. Hey, keep doing this. In addition, here's a new thought, also create standards and guidelines for appropriate education for providers. And I just was trying to figure out how the two were tied.
So based on the discussion, if it's helpful, Jason, since this was something that was checked off the
Sure.
previous recommendation, it was just how do we keep this going to make sure now that we have the service available that everyone knows how to use it.
I guess that maybe I didn't explain myself well. We're assuming this is not indefinite, right? Or are we assuming it's continue just means indefinitely?
Mm-hmm.
Yeah.
We are. Okay. All right. I understand now.
Until a legislature comes in and changes everything.
I get it. Okay.
All right. Any other edits? Otherwise, again, thumbs up, head nods, smiles. Great. Okay. 10.4, originating and distance sites. And some of the 2020 language was removed, and that was just around the definitions of originating and distance sites. So this is the remainder of your recommendation now. Any edits, substantive or technical? And scroll a little so you see your collaborators as well, along with your action lead and your measures.
Could you scroll just a little bit further down, please?
Sure.
Thank you. Thank you.
Representing Landwehr here, all we did is remove some of our 2020 language, it appears, correct?
Yep. All you removed was the definition of originating and distance sites, since they are already defined in the Telemedicine Act.
Yes.
All right. If there's no changes, head nods, thumbs up. Yeah? All right. Okay. Here's your last one. So child welfare system, again, a very small revision, but to really explore the unique needs of parents in this one. Any other additional technical or substantive edits for this one? And again, here are your partners, action lead and collaborators. And there are a slew of measures. All right, I'm not hearing any edits, so thumbs up, head nod, smiles if you're in agreement. Yay. All right. And then there's just a lot of appendices, okay? And so anything that you have changed, especially to 10.1, we'll make sure it's reflected throughout the report. All right, so I'm going to stop sharing now, and now's the fun time where you guys get to volunteer. So as Representative Landwehr stated earlier, the special committee meeting has been moved to December 15th. However, it's the same agenda as December 10th, so your slot is 10:50 to 11:30. And so please, please, please make sure you are logged on at least 5 to 10 minutes in advance, if not for the entire meeting, and make sure you are available during that. And so just to give you a rundown for those of you that weren't here in the 2020 meeting, at the special committee meetings, I'll ask our co-chairs to give an initial overview of the new topic assigned to the work group. And so for you. That's Dr. Shauna Wright and Sunny Mickle. And then we also, from there, will have special committee members usually asking questions about the recommendations and revisions that were put forward by this group. And so to ensure that we have work group members queued up to speak on each of the recommendations, just so your co-chairs aren't, the only ones talking during that meeting, I was hoping to kind of just run through each of the recommendations and get volunteers. Again, anyone is welcome to weigh in on any recommendation, but I just want to make sure that we have someone who feels empowered to speak first. And so that's why I wanted to make sure I gave everyone a chance for this. And I wanted to make sure we did it now so you have time to gather any thoughts, review any of the past meeting minutes, just to like refresh your memory. So with that, the telemedicine committee right now, as the co-chairs will discuss the new topic, they'll present the recommendation. But are there any other members that wanted to speak up about this recommendation? I'll note your name.
Representative Landwehr here. What I might add is if it's possible that we do complete this on the 15th, if not, the 16th will also be included.
Okay.
The agenda doesn't change, okay?
Okay.
Is any member that's on any of our working groups are more than welcome to attend all day long on there with us in case questions, do come up and stuff, which is always very helpful to us. So if your time allows that, that would be wonderful. Thank you.
Thank you for that clarity. Again, Hina Shah, KHI. Any other volunteers around the Telemedicine Act?
This is Jason, University of Kansas Health System. Happy to volunteer.
Thank you.
This is Jennifer with KHA. I could speak on this one too.
Okay. All right. Then moving on to 10.1, that telehealth quality assurance recommendation. Any initial volunteers there? Co-chairs, you may want to help with recruiting, otherwise it's going to default to you. You can also assign people that aren't here. I can reach out to them. So just remember that too.
When you don't show up, you get appointed.
Is it helpful for me to show you the recommendation again as we go through this? I'm seeing some head nods. All right. Okay, so this is the one that we talked about where we'll tie it back to recommendation 10.6 and assign the charge to them.
This is Sandra with United. I can talk about that one.
Right. Anyone else? All right. The next one is the telehealth reimbursement codes. How about this one? Any volunteers?
This is Jennifer with KHA. I could help with that one.
All right. And Sarah, I'm not volunteering you, Sarah Fertig, but I think she'll be available during the call if there's any questions as well.
Absolutely.
And I'm also happy. This is Jason from the University of Kansas Health System. I'm happy to be a backup to Jennifer. I'm sure she's more than capable than doing that, but I'm happy to be a backup as well.
Sounds great. Thank you. All right, then the next one is telehealth for crisis services. Who would like to volunteer for that one? Is there anyone else? So Sarah will be there. I believe Andy Brown will be on the line as well from KDADS, but anyone else from this group that want to talk about at least the addition and revisions to this recommendation? All right, it looks like Shauna and Sunny, you may have to take this one. And if anyone wants to after, let us know. Is there anyone that's not here today that you would recommend as well?
This is Shauna. I'm happy to take this one. And if Andy wants to back up there, that's fine as well.
Terrific. All right. So the next one is the revised originating and distance sites recommendation. Who would like to speak on this one?
This is Sunny Mickle from Blue Cross. I feel comfortable talking about this one in depth, but also if we can have our revisor statutes on the line available to talk that day, that'd be really helpful.
Eileen, will you be available?
Yeah, I can be, I plan on being on the call, or rather, I will be available virtually. So yeah, I can step in if necessary.
Representative Land, we're here. The revisers do not allow us to meet without them present.
Thank you.
Chair Landwehr, that's because we keep you out of trouble. That's what you pay us for.
That's why I love you guys.
All right, and the last one is the one around the child welfare system. Who would like to speak on that?
This is Sandra with United. I can talk on that one.
Okay. Terrific. Well, thank you. And so, again, December 15th, I think the new agenda will go out to everyone at that point. And so just for good measure and since I have the report open, one last kind of thumbs up, great, confirming consensus on your section of this report.
This is Jason from the University of Kansas Health System. I can't remember the gentleman, I think he was a physician who spoke last week, was asking for the terminology between telemedicine and telehealth. We use telehealth over 110 times in this document and telemedicine about 20 times. I think there was a question in last week's, do we actually have a defined definition of the difference between the two, or are we saying they're interchangeable? And I think it was more of a question he threw out in the universe, and we never really addressed it, but I noticed this document actually says both of those terms. Is there something that we're concerned or need to be concerned about that? I just remembered his comment last week, and then noticed that when I counted the number of times they were done differently in this document, does it matter? And if so, I'm not 100% sure of the difference between the two. And I am guilty of, even though this is my department for the entire health system, of using them interchangeably. So I just want to make sure this is very important work that I know that we have it explained here in this document, if it matters.
I appreciate the distinction. The only technical comment I'll make based on the language that was used, you're going to count it multiple times because it's in the appendix, it's in the beginning, it's in the middle, and the end.
Yeah.
So telehealth is what this work group is called. So you'll mostly see the word telehealth. The committee was intentionally called the Telemedicine Committee because it ties back to the Telemedicine Act. And so that's why that language was used instead of a telehealth committee, just to keep the language there. I will defer to the work group if this is something that you want to think more about before the next special committee meeting where you could bring this up. But I will say just technically, that's one thing that might have been that difference between 100 and 20, because it's only that new recommendation where and anytime we use the Telemedicine Act where you'll see the word telemedicine.
And this is Shauna Wright with the Center for Telemedicine. I'd like to ask Eileen, because I do believe that in the Telemedicine Act, it says the terms can be used interchangeably and it does not define them separately, but I'd like to verify that with Eileen.
Shauna, it says telemedicine includes telehealth. It doesn't say that the terms can be used interchangeably.
Does it define them differently so that we understand how the law looks at those terms differently?
No, telehealth is defined, telemedicine is defined as including telehealth. And honestly, the reason that it's called the Telemedicine Act is because I had two telemedicine, telehealth bills, And one was telehealth that year, and this one was telemedicine that year, and the Telemedicine Act got passed.
Right. And so just for common reference for the committee, this is Shauna again for the Center for Telemedicine. Many different entities define the terms differently, but oftentimes in our training and when we train students, we tell them that telehealth is actually an umbrella term that includes anything that is technology-enabled healthcare, and that could include education, that can include that webinars that are education, Project Echo that's education. It can include direct client services. It can include even public health announcements that go out. It's technology-enabled healthcare in all of its forms. So oftentimes we see the telehealth term as umbrella and telemedicine as being more specific to the actual delivery of healthcare services. And there are lots of different things that can fall under that umbrella: telepsychology, telemedicine, teleoncology. And the terms are often used interchangeably. Some insurers have their own definition for what telemedicine is versus telehealth. And maybe Sunny can help clarify this, but some consider telemedicine to be prescribed by the provider. I want you to engage in telemedicine. This is how we're going to do it. Whereas they may look at telehealth as services initiated by the patient. They are seeking something online versus being prescribed that as a service. So there's a lot of different ways that different entities might interpret those two terms. So I don't know if it's something that we might want to ask the special committee to help us clarify, but oftentimes telemedicine looks at the direct delivery of healthcare and doesn't necessarily include the other tenets of telehealth, which would include, education and public health types of interventions that aren't direct medicine.
Hina, it's Eileen from the revisor's office.
Yes.
Can I go ahead and speak to that?
Thank you, Eileen.
Great, thanks. This has been called the Kansas Telemedicine Act since its enactment in 2014. It has been cited to, named, and is listed in statute as being able to be named and cited as the Kansas Telemedicine Act. I would not advise changing its name at this point because it's 7 years now where it's been formally named as. If the industry, if the professions use the term telehealth, that's great. This is just law. This is statutes that are referred to that way. As far as the statutes go, telemedicine, telehealth, they're defined using terms. And as I said, they pertain only to the reimbursement of healthcare services. So it really doesn't infringe upon what you're calling them. It's only pertaining to the reimbursement thereof. So it's really, I don't think at this point that it's necessary to change how the terms are referred to in the act.
This is Hinasha, KHI. One thing you could consider is last week, the Telemedicine Committee name was kind of thought through as relating to the Telemedicine Act. The only thing I'll pose is if you wanted to stay consistent with other terms throughout, you could call this the Telehealth Committee. I will leave that up to the work group if you wanted. And then, Jason, any instance of telemedicine would only relate to the Act. Knowing that telehealth is more of an umbrella term, would the work group like to defer to calling it the Telehealth Act, or would you like to stick to calling it the Telemedicine Committee?
This is Sunny Mickle from Blue Cross and Blue Shield of Kansas. I prefer to be consistent with what the legislature is familiar with the Kansas Telemedicine Act, and use the term telemedicine.
I would agree.
Yep, this is Jason from the University of Kansas. Sunny, that is a great recommendation, and I would agree.
All right. So
And
then
this is Shonda, right? I agree as well. My only question goes back to you, Jason, in that when we do use the term telehealth in documents like this, do you have assurance that we are including those direct patient care? Is there any qualm with that, or is it?
There really isn't qualm. I just was, when my concern was with the gentleman who spoke last week who wanted definitions around the two. If we were going to put this into a recommendation and then have it written into law, that there was some sort of concern in my part that we were in fact saying, this is included, this is not, by saying one of the two. And in addition, when I read this document, that someone outside who was reading the document would see we were using the two words and someone would question, oh, do they mean something different? Because you're actually saying two different words. And so that was my only concern. If we were stopped in a presentation next on the 15th or 16th, just someone saying.
It's Eileen again from the Revisor's Office, and I've got the definitions statute pulled up, and this is KSA 40-2, 211, subsection A5, and it's telemedicine, including telehealth, means the delivery of healthcare services or consultations while the patient is at an originating site and the healthcare provider is at a distant site. Telemedicine shall be provided, blah, 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 blah. So I think it's pretty clear that the two terms mean the same thing and can be used not interchangeably, but can be used, I'm sorry, that the definition can be used pertaining to both terms. So I think that the act needs to be referred to by its formal name. It's not appropriate to refer to it as a telehealth act because that's not how it's cited to in statute. But I think you're fine using the telehealth term because the term telehealth still means the same thing as telemedicine in the act where it's defined.
This is Sandra with United, and I think the important thing here is the scope of what we're trying to accomplish. And I think the scope is staying within that telemedicine definition of the services that we're providing and not getting into more of what you were talking about, Shauna, that falls into that broader umbrella. I don't think we were heading into that area. We were heading into the actual medical behavioral services.
thank you for that point of clarification. This is Hina Shah, KHI. Any other comments about the telehealth section of the work group report? All right, then for good measure, one last head nod. Oh, go ahead.
Sorry, this is Sandra. Do we need to put that clarification in here? I mean, if it's not clear, do we need to add that this is about the scope of services that are delivered through technology as defined by the Telemedicine Act?
I'm going to share my screen first so you have to take a look at your vision and see if that's clear enough.
Okay.
Representative Landwehr here, I think that suffices.
Yeah, I do too.
I agree.
What I would recommend, I think when I went through the statutes, I provided the Telemedicine Act, all the statutes in one document. You might add that to the documents that are available. So if necessary, the committee members can refer to them, but not necessarily, have them out and printed or formally available, but just have them if they are necessary.
Thank you, Eileen. And so one point of clarification, their meeting materials are available online. They're in 2 locations. We have them published on the KHI website, and they're also available on the KS Legislature website. And so Eileen's presentation is on there from the meetings earlier. It was your second meeting that it was at. I think it was the 20th of October, but don't quote me. And so you can look through those materials, and then the notes are always published on the subsequent meeting date. So definitely look through those materials. Thank you for that point. All right, I think third time's the charm. So with that head nod, thumbs up, smile, are you comfortable with all of the revisions that have been made to your section of the work group report? Yay! Well, good job, guys. It's been a pleasure working with you, and I look forward to seeing you at the special committee meeting. I will send kind of follow-ups, letting you know what sections you will be presenting. You will not have to write up formal testimony. Yay! The work group report will serve as your testimony. So please show up and be prepared to discuss.
Hey, this is Jennifer with KHA. A clarifying question. Is that meeting on the 15th virtual or is it in person?
Both options are allowed.
Okay, thank you.
And
Yeah,
one further clarification, go ahead, Representative.
No, go on.
My other clarification, my ears might be maturing as much as my eyes. Did you say 10:50, 10:50 is the start time for our work group, or 10:15?
No, that's a good clarification. So it's 10:50.
Thank you.
Can you send out that invite for this December 15th?
Yes, I can make up like a little Outlook invite if you want, just so it holds on your calendar, but official invites are sent by Cloyce, Robin, who's on here. And so she usually sends out the official invites for it.
And would you mind putting page numbers on the document? Or maybe
There should be page numbers, and if there aren't, we'll make sure there are.
This is Shauna. I believe they're in that footer along the bottom. It's a really light print.
I have bad eyes, so they're probably there.
It's light gray, so it depends on how sensitive your printer is.
Yeah, I probably didn't pick it up.
And there are lots of hyperlinks, so if you want to follow along electronically, you can kind of bounce around the report as well. But I know, I love paper copies too.
I'll also add that some of the links will still be added. There's still some technical editing going on in the background. Won't change any of the content, but most of the links are there, but some of them, like the second line, takes you to a different place. So those will be corrected before it's finalized.
Representative Landwehr here. I just want to thank everyone for taking the time to help us work on this. I could not do this without the staff that I have behind me in the Capitol, or now I'm going to claim the staff at KHI with their help, because this report that we did last year, and I think this will be the same, was probably the most valuable report that I have ever worked with in the legislature. And the thing that makes it important about actually reviewing the report online, although paper's fine, it's kind of like a summary, are those hyperlinks. Because we have brought all the other groups, committees that are looking at mental health and brought it into this one report, so that we just don't have them all scattered out there. So I can't say enough for your efforts and the time. I know this isn't easy. Everybody's got busy schedules, but I really, really appreciate it. And I know that the committee members do as well. So thank you.
All right, well, on that note, I'll give you 4 minutes of your life back. Thank you.